All right, it's a few minutes after 6 o'clock. I want to welcome everybody this evening to the February 25th general meeting. So I'm going to call the meeting to order. We have acceptance of the agenda, rules of order, follow-up from the January 28th general meeting. We'll provide an update on the land claims, an update on the MCA financial administration law, as well as an update on the COVID-19. We'll take questions that we have received through the email, and if there are any questions from the community. We have a resolution that we need to table this evening, and we have a few announcements. So if I could please have a motion to accept the agenda as presented. Moved by Julie, second by Carolyn. All in favor? All right, thank you very much. All right, so I want to welcome everybody this evening to our online general meeting. As we know that we continue to deal with the global pandemic that we're dealing with in our community and across the globe. So since March, we have been doing business differently. We're approaching a year now, and we have been hosting our general meetings on the Zoom system. I want to thank everybody for joining us this evening. So I do want to acknowledge that dealing with the pandemic has been extremely difficult for all of us. We are now creeping on to 1 year since the pandemic has started. And through the last year, we have lost a number of members of our community. And during this time of having to social distance and not gather, it's been extremely difficult for our community to grieve. And I would like to acknowledge that and ask if we could observe a moment of silence for those members that we have lost over the last month. Thank you very much. So on behalf of myself, our council, and the Mohawk Council of Akwesasne, we extend our deepest condolences to all those who are dealing with the loss of a loved one at this time. So this evening's general meeting will start at approximately 6 p.m. We're going to go through our agenda as I've read into the record already. We'll go till approximately 8 p.m. And at that time we'll assess where we are on the in regards to how far we are on the agenda. We ask, while we are using a remote system, the Zoom system, we ask that personal items not be dealt with in this form because this we still consider to be public as well. This is recorded and shared online for community members to receive the same information tonight. So we ask that people not discuss personal matters. If there are personal matters that need to be discussed, we would ask that you arrange to speak to one of the members of council or myself on a one-to-one basis, and we will assist in what way we can to find answers or a solution to your personal matters. As well, we ask that we please remain respectful at all times during this call. We do have the ability to mute, so if there are people who are being disrespectful, hopefully we don't have to mute them, but please be respectful. As well, please raise your hand or unmute yourself to be able to ask a question during the question and period time. There is the raise hand function as well for those of you that have some experience using the Zoom system. So please ask that you utilize that. I will do my best to make a speaking list and acknowledge your questions. We ask that the questions please remain relevant to the conversation that we're having. There is a time at the end for a question and answer that we can discuss some issues more broadly. But while we go through the presentation, please keep your questions in relation to the subject at hand. If there are any questions or items for follow-up that we cannot answer on tonight's meeting, what we'll do is we'll create a list of follow-up items that we will report back next month for the follow-up from this month's general meeting. So that is our rules of order for tonight's remote general meeting of February 25th. I'll now go to the follow-up items from the previous meeting, which there are none. So we have none to report from the January 28th meeting. I will now bring up the PowerPoint presentation that we are using. This material was not made available to you ahead of time. My apologies for that, but those of you that are on this evening have provided emails, so we will send out all this material to you tomorrow following the general meeting, and it will be made available on our website as well. So. I'll ask Ashley if you could please bring up the PowerPoint presentation that we will walk through this evening. So as mentioned, if you could go to the first slide, the agenda for this evening's general meeting will include the land claims update, the financial administration law, and will provide an update on the COVID-19. So. For the first part, I will ask Chief Tim Thompson to take us through the update on the land claim portion.
Good evening, everyone. Before we begin our slide presentation, this presentation is for community members for discussion only, and it is without prejudice and not for public or media distribution. So that is one of our main rules with regards to Aboriginal rights and research. I'd like to recognize our Aboriginal rights and research staff, Philip White-Cree, who is acting Aboriginal rights and research manager, Cheyenne Lazore, Teresa Benedict, and Cactus Sunday, who is on assignment as acting assistant executive director. I also want to recognize our portfolio for Aboriginal rights, Chief Edward Rompoint and Chief April Adams Phillips. And with that, we can begin the presentation. So first item will be the Jigastisle Dundee specific claims. In 1981, the Jigastisle Dundee claims was filed with Canada to account for the mismanagement of community lands. Canada entered in negotiations in 2004 to resolve the claim. On April 29, 2015, the Government of Canada presented the Mohawks of Akwesasne with a global settlement offer of $239,808,436 for the full and final settlement of the land claims. Next slide. As part of the settlement agreement, the Mohawks of Akwesasne will have the ability to purchase 18,282 additional acres of land, have it returned to reserve status through the additions to reserve policy. Between October and December of 2019, the community voted on the referendum, and with the results being 1,749 votes in favor and 448 votes against. Following the tally of results, 5 appeals were filed, and the Mohawk Court eventually dismissed all appeals on January 7, 2020, confirming the referendum results. Next slide. Council has reached out to potential custodial managers for short-term financial management of the funds and still needs to conduct a community consultation. The consultation must occur before an implementation process for the settlement funds and the structure of benefits are put into place for the benefit for all Akwesasne. Due to the COVID-19 health emergency, the consultation process is currently delayed. We will now go on to the COA claim. Next slide. The COA claim was filed in court in 1976 regarding damages to the reserve related to the construction of the seaway in the 1950s. Some aspects of the claim have been dismissed and other parts have been negotiated out of court. Parts of Gawanoga, known as Block 1 lands, entered into the additions to reserve process. Next slide. In 2008, the past grievance final settlement agreement was signed between the Mohawks of Akwesasne and Ontario Power Generation after a community referendum. 46 million has been placed in the Akwesasne Settlement Trust. 4 islands are now in additions to reserve process, and community employment opportunities were created. Next slide. The settlement offer has been reached regarding the Seaway claim with an offer of 45 million to settle the claim in June 2018 via MCA 218-219 number 80, which was updated in October 2020 with additional lands being eligible for additions to reserve. Referendum regulations were passed by Council on November 16th, 2020, and that would be MCR 2020-2021 number 196, with anticipation to conduct community education and a referendum in the near future. And again, due to the COVID-19 health emergency, the education education process to the community has been delayed. We will now go to the 1796 treaty, or known as the US claim. In 1796, the treaty, the US claim was filed in court in 1982 regarding the title of lands, including islands, under the 1796 treaty with New York State. This was jointly filed in 1989 between the MCA, the St. Regis Mohawk Tribe, and the Mohawk Nation Council of Chiefs. The negotiations led to a proposed settlement in 2004 with successful community referendums conducted by MCA and the St. Regis Mohawk Tribe. The negative 2004 Oneida Supreme Court ruling ended New York State's support for the proposed settlement, and aspects of the claim have been dismissed on laches, citing the 2005 Cayuga decision. Since then, New York State has been conducting discussions on the remaining aspects of the claim. The St. Regis Mohawk Tribe has taken lead and provides updates to MCA regarding the claim. Currently, there are active discussions between parties for a possible framework on settlement and preparing for court. Council will continue to update the community as this file evolves. Baxter and Barnhart claim. There are currently 13 claims in research with the Aboriginal Rights and Research Office. After substantial research, each claim will be filed with Canada. Additions to reserve process. Under Block 1 lands, these are Gawanoga lands in relation to the Seaway claim and are now administratively reserved following a ministerial order by the Indigenous Services on December 11th, 2020. We have 4 OPG islands. These 4 islands, Adams, Pasquille, Tucson, and Sheik, are upstream from the OPG power dam in relation to the Seaway claim. The Cairn Islands, this is it's in the Raisin River area, and we are working with Parks Canada. And if there are any further questions, they may be directed to the Mohawk Council Chief's Office at 575-2250. And if there's any technical questions, they may be directed to the Aboriginal Rights and Research Office at 575-2250, extension 2133. And just a reminder that Mohawk Council offices are staffed at 30%, I believe, or is it 50%? And okay, 50, and we're not open to the public at this time. We will be reassessing that as of March 8th to reopen to the public. And that's all I have at this time. Thank you.
Thank you very much, Tim, for that. I see that Brenda's iPad has a question. So while we're switching the PowerPoint here to the next PowerPoint, I'll ask, I'll go ahead and have Brenda ask her question.
Hello, everybody. What I'd like to know is with the Dundee claim, and you talked about a community ratification process. Could you explain what that process entails?
Tim, you want to go ahead?
I would prefer Phil, if he's on the line. Can he take that as a technical? But it will be, go ahead, Phil.
Right. Thank you. The referendum was passed, but I believe you might be inquiring about the community consultation.
Yes. And then how is it ratified, or is it ratified?
It was ratified by community referendum, accepted by council. They passed an MCR to sign it. The parties have signed it between MCA and Canada. So now it is in implementation phase.
Okay. So now, what is the community consultation process? What does that entail?
That will be forthcoming, and council will provide those details when they are finalized.
I've asked this before, and I'll ask it again, and hopefully I'll see it in the process, but you know, that's not a whole lot of money to be taking over those lands in Dundee when it comes to delivering community services to our people that are going to be living out there. And I would really like to see a strategic plan for the next 20 to 50 years, however long it takes for us, for the community to start buying the land back, on how those services are going to be used and what the financial projections are going to be for that. I think that's really important, because it may end up that at some point there will be no money and we'll have to find ways to provide services, you know, school buses and healthcare and roads and housing and all of those things. So I ask that that be taken into consideration for the future. And I don't know if council has any plans or proposals on how that's going to benefit the whole community or not.
So for council, and we haven't had the full discussion with that, but we will take that into consideration. We still have to officially meet with their custodial manager also, and go from there on any further discussions. But your comments will be taken into consideration and taken back to the table when those discussions begin.
Can you explain to me before you finish, what is a custodial manager?
Edward, want to take that one? The interview process?
According to the agreement, the funds can only be short-term invested under very secure portfolio parameters. It was in the agreement, and that is basically the money cannot be touched, but it could potentially grow. And there were a few options available, and until there's community consultation as to what is the final process of utilizing those funds, the money cannot be touched. So what has happened was, since last year, there was a call out in the interview process of financial services, a custodial manager, potentially to look over the money and ensure that it could grow in some capacity. It has only been preliminary interviews. There's been nothing officially outside of the money being just in a bank account at this time.
Are there any native companies that have applied for that?
We did reach out to our financial advisor, and that organization provided a list of potential firms that have the capacity to deal with this amount of money. And all four of them have had different Indigenous personnel or relations involved. And we did look at shortlist 2 potential firms, but nothing beyond that has taken effect as far as I'm aware.
Okay.
So there was a small committee of chiefs that sat on the interview process, and I'll let Edward speak to that.
Thank you, Dooley. So yeah, several of us chiefs have been asked to sit on the interview team in regard to the custodial account managers. So that our team, alongside of finance, went into very in-depth discussion in the selection process. And so we had to ensure that the custodial account manager that we did select had really understood working with First Nation community and how things are operational and different from working for clients outside the territory. So it took quite some time, and we basically selected the custodial account manager that's handling this now, and they realized that it's just a short term, as Philip had mentioned. It's just the first part of many other short-term goals we have to get to, where the community consultation is the next one coming up, where the community has to provide its input as to how and this settlement dollars is going to be invested and utilized.
All right.
So when you do that consultation, is that when you're going to have the strategic plan laid out for people to review and make comment on or reject?
That is something we can include in our discussions as we develop what that consultation is going to evolve into. So it's definitely, we will put that into consideration in the development phase of it.
Just because for me as a community member, if I know that over the next 50 years, all of that money is going to be needed to do something else with Dundee, I'm not going to be putting up proposals for other things, because then it draws away from our own community dollars that we get from other sources.
You know,
so for me,
I
that's
agree.
Important. You know, it's important for me.
Yeah, and one thing to keep in mind is there is a percentage of it. I do believe it's 50% of it is to be used for the purchase of land. So,
exactly.
Yeah.
Exactly.
Yeah. So,
and if they're charging millions of dollars for an acre, it's not going to go very far.
No,
it also is limited to agricultural, isn't it? Because it's been designated agricultural.
No, not necessarily. Not necessarily. If it turns into reserve, then it's under the control of the Mohawk Council. But
and it also doesn't have to be in the Dundee area. Am I correct?
Yeah, that's correct.
It can be bought, and if there's opportunities to buy in Ontario also, we can buy in Ontario also.
Okay. All right. I see. Thank you, Brenda, for that. Thank you for those comments. That would be part of the consultation process. We'll be looking for community feedback on the longevity of these proceeds for the community. I see that Cheryl has her hand up, so I'll go to you.
Can you hear me?
Yes, we can.
Oh, can you still hear me?
Yes, we can.
Oh, okay. My question was, of the 239 million, have they determined how much will be clawed back, so to speak, for the legal fees and everything that was put up front? I guess I'll use that term. Have they come up with that amount yet in the discussions, so that by the time we get to the consultation process, that we'll have a true number of what we're talking about as far as what we're all benefactors to? Yeah.
So the 239, the money that was taken from that would have been money that we got through loan funding, and I think it was around $4 million on that. If that's, yeah, I see some nods. Any legal fees we've paid as we gone along, so it's not, there wasn't a fee to be paid for the settlement amount.
Okay, thank you.
You're welcome. All right, thank you for those questions and comments on the land claims, and thank you, Tim, and the Arrow staff for putting that together. We're now going to turn to the update on the financial administration law. So I'll ask Edward to take us through this presentation.
Okay, Nyawa. So this is an update on the financial administration law. And this first slide we're looking at is just a quick timeline just to demonstrate from when the FAL was passed to where we are currently today. So on August 24th, 2019, the FAL was MCR'd and passed. On September 1st, it came into effect. March 16th, 2020, the COVID-19 pandemic had hit Akwesasne, and Mohawk Council declared a state of emergency. The MCA organization began operating in emergency mode, requiring essential workers to remain working, as well as other departments that weren't deemed essential to resort to remote work. In September of 2020, the Finance Committee had resumed. And on November 5th, 2020, the Finance Committee had met and made a change to the schedule to meet bi-monthly. On February 16th, 2021, we had a special Finance Committee meeting in which the Comptroller Richard Fournier and Robert Delarmier, Director of Finance and Administration, gave us a presentation on the operating budget for the upcoming 21-22 fiscal year. On February the 22nd, 2021, at a council meeting, a Mohawk Council resolution was passed appointing the members for chair and vice chair under the FAL Part 3, Division 1, 8.2b, whereas District Chief Edward Rompoint was appointed chair and District Chief Connie Lazor was appointed as vice chair. Also in the same meeting on February 22nd, 2021, Council had begun discussion on establishing the eligibility criteria to be a member of the Finance Committee. Next slide, please. Going forward, under Part 3, Division 1, the Mohawk Council of Akwesasne has begun the review of the current finance policy that was established pre-FAL. As a baseline, this will be updated from the latest version to reflect the content put forth in the FAL. So the second part is just the reiteration of the MCR that was passed appointing the following positions. Again, that was the chair, District Chief Edward Rompoint Gawanoga, Vice Chair, District Chief Connie Lazor, Jisnaina. Next slide, please. Establishing the Finance Committee. So under Part 3, Division 2, the Mohawk Council has begun the necessary steps to establish the Finance Committee according to this section. 11.4a reads, Council shall establish criteria to determine if an individual is eligible to be a member of the Finance Committee. So on that part right there, that goes back to what I stated earlier in the timeline, where we begun discussion on establishing that criteria. And some of the areas that we're pulling from is from finance. We have our comptroller and our director of finance and administration who are going to provide us certain criteria that's going to kind of lead into the competency of understanding finance. So when you look at 11.5, council to determine the size of the committee being A, 5, at least 2 shall be members of council together with 3 members of Akwesasne. Or B, 6 or more members, 3 being members and the remaining seats being members of council. Next slide, please. As part of the criteria being established, members of the Finance Committee shall have some financial competency. For the community members of Akwesasne, they also need to be independent from the organization. Now, a question came up. Oh, go back, please. A question had came up in an inquiry regarding the word independent and how it was being applied. So when we examined that section, we realized that independent meant that the community member was to be independent from the organization, being Mohawk Council of Akwesasne, the administrative organization. And so that was how we looked at the interpretation of independent. Among these 2 points, there's other parts that are going to be coming forth again, that's coming from the comptroller as well as director of finance. And also we're going to be looking at other areas where we could examine to see where other criteria in other organizations that have this type of body, to see what they utilize. So this is kind of where we're at currently. Next slide, please. Upon completion of the following objectives presented here in this update, the Mohawk Council can then support the transition from the current Finance Committee into the newly established Finance Committee under the Financial Administration Law, also known as the FAL. The current Finance Committee will operate under the FAL to the best of its ability as it continues its duties and responsibilities. So this is where we stand currently in regards to where we are in the implementation of the FAL. There are sections of the FAL that are being followed as of today when it comes to the finance department and the reporting and stuff. So we're just, you know, with the whole COVID, and even there was a lag before that, you know, there was many working mechanisms that we were preoccupied with. But now where we've kind of have this system that we've got the finance committee going, and now the first step is establishing this new finance committee, in which once we get that criteria established, we will be making a call out community, because there will be community members that will be sitting on this committee along with council members. So this is where we are, and within the next several weeks, I will provide another update again going forward, and to keep the community updated on how things are progressing. We're going down this pathway to develop short-term goals so we can achieve some of these parts that are identified in the FAL. So as we move along in the FAL, parts where council has to establish certain things, we can get these out of the way and get everything in motion, so that you know, eventually the whole FAL can be fully operational. So we just, you know, we thank the community for its patience, and some of the inquiries we've been getting, it's really helping us identify certain areas and key points. So we'll keep everyone abreast of this as it evolves and develops over time. Nyamo, and if there's any questions, I'd be happy to answer them to best of my ability at this point.
Okay, thank you, Edward, for that. While we wait for if there are any questions, we'll transition back to the other PowerPoint presentation, please. Okay. All right, thank you very much for that. If there's no questions, we will move along on our presentation. So I'll now ask Julie if she could walk us through the next few slides, please.
Good evening, everyone. I'm going to go through our COVID-19 updates for this evening. So our current COVID status. It's been over 11 months since we declared a state of emergency for Akwesasne. We acknowledge that dealing with the pandemic and practicing all the necessary precautions has and continues to be very challenging for everyone. The deaths in Akwesasne due to COVID-19 are an unfortunate reminder to everyone of why taking every precaution is necessary, especially for the safety of our most vulnerable community members. We extend our deepest condolences to all those who are affected by the loss of a loved one during this difficult time. On behalf of the Mohawk Council of Akwesasne, thank you to everyone who continues to practice all the recommended precautions day in and day out in our fight against the spread of COVID-19. It's really important that as a community, we not adopt a sense of false security about this pandemic. It isn't over and everyone is still at risk. We have to continue to be smart and responsible. Please be sure to continue wearing a mask and maintaining a 2-meter distance from others when in public. COVID-19 updates, our current status. The numbers of positive cases of COVID-19 in Akwesasne and the surrounding areas are still very concerning. Here are the statistics as of February 25th, 2021. In Franklin County, they have 319 active cases and a total of 2,072 total cases. St. Lawrence County, 477 active cases with 6,061 total cases. The EOHU, 108, and their total cases are 2,769. Cornwall's active cases are 26, and the total cases are 723. MCA, our active cases right now are 34, and our total is 236. The St. Regis Mohawk tribe is at 50 active cases with 235 total cases. Jiquinunzade Long-Term Care Facility update. On December 11th, 2020, an outbreak of COVID-19 was declared at Jiquinunzade Long Care Facility when 3 staff members tested positive. This outbreak continued until this past Monday, February 22nd, 2021, when Jiquinunzade was officially removed from outbreak status following 2 weeks of negative COVID test results for all staff and residents. The outbreak resulted in, The outbreak resulted in the death of 6 residents at the facility. On January 23rd, 2021, an outbreak of COVID was declared at Yakisutta Lodge when 1 staff member tested positive. On February 10th, 2021, Yakisutta Lodge was removed from its outbreak status following 2 weeks of negative COVID-19 results for both residents and staff. On February 16th, 2021, MCA received confirmation from the Eastern Ontario Health Unit that another staff member of Yakisutta Lodge tested positive for COVID-19. MCA extends our gratitude to the staff and the administration members of our long-term care facilities who remain diligent in their duties and followed safety protocols during this time, ensuring that no other residents or staff were exposed. We would also like to extend our gratitude to the residents' families and community members for their understanding and their positive thoughts throughout this period. We currently have 34 active cases within the northern portion of Akwesasne. The MCA extends its best wishes for a speedy recovery for all of those to all those infected. If you have any questions about COVID-19 or testing, call the MCA Community Health Program at 613-575-2341, extension 3220. We would also extend our we would also like to extend our appreciation to those who are isolating and quarantining to prevent the further spread of COVID-19. The Akwesasne Community and Quarantine Program. For anyone residing in the northern portion of Akwesasne who is currently in quarantine and needs assistance, you can call 1-800-480-4208 or 613-937-4322 to receive basic food supplies and essentials. The community in quarantine program is designated or designed for community members who have no assistance or resources to help them throughout their quarantine isolation period.
Thank you, Julie, for walking us through that those few slides. I'm now going to go to Carolyn, if you will, take us through the next couple slides.
Sure. Good evening, everybody. I'll go through the current restrictions in regards to the pandemic that we're going through. Next slide. In Akwesasne, the restrictions within MCA's jurisdiction include the community curfew from 11 p.m. to 5 a.m. and the travel radius of 100 miles or 160 kilometers. On January 12th, 2021, the province of Ontario declared a second state of emergency and issued a stay-at-home order, which was in effect from January 14th, 2021 until February 16th, 2021. The Eastern Ontario Health Unit, which includes Akwesasne, is currently in the province's orange zone status. This is a restrictive status that will remain in place for at least 2 weeks. Next slide. So here is the color code system. So you see in the green, it's prevention, education and awareness information sent out to the public to keep the community and workplaces safe. The yellow is protection, strengthen and improve health and safety control measures to keep community and workplaces safe. In the orange, it's restrict, implement enhanced and health and safety measures with added restrictions to keep the community and workplaces safe. And the red zone is control, implement stringent health and safety control measures with additional restrictions to control COVID-19 spread and transmission. The gray zone is lockdown, implement maximum health and safety control measures, maintain restrictions, and begin lockdown processes. These are health and safety measures that will ease up as trends in the public health improve. So we're hoping to get into the green. Currently, we are in the orange zone. Next slide. Oh, wait, go back. I'll read that fine little print on the bottom. For more information on current health measures and COVID-19 testing, please contact the MCA Community Health Program at 613-575-2341, extension 3220. Next slide. Under the orange zone status, organized public events and social gatherings are limited to 10 people indoors and 25 people outdoors. Restaurants, gyms, retail establishments, and other facilities are open with strict limits in place. These include wearing masks, maintaining social distancing, and restrictions on opening and closing times for businesses. The zone status for the EOHU is subject to change upon reassessment, which will occur at least every 2 weeks. Next slide. There are now 3 variant strains that have been reported in Ontario. These variant strains originated in the United Kingdom, South Africa, and Brazil. These variants are mutations of the original COVID-19 virus, and they exist due to the virus circulating in different areas and populations. The more the virus circulates, the more opportunity it has to change and mutate. Recently, concerns about the variant strains and the efficacy of the vaccine against these strains have been, I don't have the next slide. Oh, I didn't get that last, I couldn't see that last
It was
part.
just raised, the word raised.
Oh, okay, thank you. Evidence shows that the 3 variants are more contagious than the original COVID-19 and have a shorter incubation period, which results in rapid transmission. This is deeply concerning as there is now potential for a 3rd wave due to these variants. Despite the growing number of variants in Ontario, the COVID-19 vaccine is still very highly recommended. Next slide. It was recently announced that new COVID-19 border restrictions were being imposed by the Government of Canada that require non-essential travelers arriving in Canada from the US to submit a negative COVID-19 test result from a test taken in the past 72 hours. This new restriction began on February 15th, 2021. On February 17th, 2021, MCA announced that we had received confirmation from CBSA that Akwesasne residents are exempt from this new requirement. Next slide. MCA's resumption plan has been implemented. As of February 16th, staff began a staggered transition back to the workstations, with buildings operating at a maximum of 50% capacity. At this time, MCA is set to return to normal operations as of March 8th, 2021. It's important to note that these timelines are subject to change based on the number of positive cases of COVID-19. Next slide. For the Akwesasne Mohawk Board of Education, reopening dates have been tentatively set as well. The March break has been moved to March 1st to the 5th, 2021. Remote online learning will continue until April 9th, 2021, and students in the hybrid model will return to school on April 12th, 2021. For the Akwesasne Child Care Program, child care centers will reopen for the children of essential workers on March 1st, 2021. On April 12th, 2021, the child care centers will fully reopen. Next slide. Thank you.
Thank you, Carolyn, for walking us through that. Daryl, I'm going to go to you just to walk us through this part next, please.
Thank you, Grant Chief. Welcome, everyone, tonight. I'm going to read the COVID vaccine rollout. Next slide, please. The Mohawk Council of Akwesasne Department of Health and Community Health Program is making plans for the community vaccinations of COVID-19. Due to the limited supply of vaccines, to ensure we receive the number of vaccinations needed for our community, we are asking all community members to call in to pre-register. To pre-register, please call Community Health at 613-575-2341 extension 3219 or 3247 to do so. Next slide. The vaccines we received are made by Moderna and are administered in 2 doses. Once the initial vaccine is injection is given,
It's followed by a booster injection given 21 days later. Seems Daryl's internet, the glory of having virtual meetings, has cut out on him. So at this time, the MCA has only received enough vaccines to vaccinate the residents and staff of both of our long-term care facilities. The second dose of these vaccines were administered on February 13, 2021. A vaccine priority framework was developed by our Department of Health, and the next group to receive the vaccine will be central frontline staff such as healthcare workers and first responders. After that group is completed, elders age 60 or better will be in the next group, followed by adults within the 3 districts, and Akwesasne living in Cornwall will be in the last group. Daryl, I see that you've joined, so I'll turn it right back over to you. Now you're muted.
Okay, we are currently awaiting vaccine shipments from the Eastern Ontario Health Unit to continue vaccinating community members in Akwesasne. It is important that everyone is aware that even after you receive the vaccine, you still need to take all safety precautions. This is because it will be a long time before we have what is being referred as as herd immunity or population immunity. Next slide. Herd immunity happens when the population is immune either through immunizations or previous infections. It's been reported that 70 to 90% of the population needs to be vaccinated for herd immunity to be effective. We must all keep doing our part, including wearing a mask, maintaining a 2-meter distance from others when in public, and avoid physical gatherings with anyone outside your household. This is extremely important. Next slide.
All right. Thank you very much, Daryl, for helping us walk through the last part of our update on the COVID-19. Before we turn to the community on questions in relation to the PowerPoint presentation or other matters that they wish to discuss, I do want to turn to Tim, who just has some follow-up information in relation to the land claim update.
So just a part of that follow-up, there was a question in regards to how much money was kept for the promissory notes. So the total Dundee land claim settlement amount was $239,808,436. Canada kept $2,952,650 towards the settlement of promissory notes. On April 6, 2020, MCA received $236,855,786. That same day, MCA transferred. So we received the 236, and we transferred $136,855,786 was transferred to CIBC, one of our investment advisors, and we also transferred 100 million to Case Populaire, another investment partner. As of October 31st, 2020, we have interest income on that funds earned is 1.456,573 and some cents. In 2019-2020 year end, we had accumulated land claim settlement costs for legal and Avero was 4.2 million. And that was reported in our statements, our financial statements.
Okay, thank you. So that was additional information from the question earlier on what the amount that Canada was owed for loans and then what it cost the MCA to negotiate the claim. So I'm going to now open it up to any questions from the community from the presentation or any other items that any of the members on the Zoom platform would like to discuss. Brent, I see Philip, you have your hand up. We'll go to you first, and then I see Brenda.
Just a quick question. Is the Emergency Operations Center still open and functional and taking calls?
Yes, it is. It's still currently it's manned from 8 to 5 daily, and they do have a direct phone line.
Sego, thank you for that. We're just wondering about, so what, after 5 o'clock, who would you call if there's an emergency? If it's not the EOC, who would you call?
I think Grand Chief froze also. you would call Central Dispatch. They have direct numbers to any member of the ELC.
Yeah, well, so for some other questions dealing with COVID, we're just wondering about the, so any plans moving forward, like as far as now that we have collected some solid statistics, so moving forward, is there a plan? Does council have some kind of a plan strategically to protect the community or safeguard the community in the future, or looking at like in the event of a future pandemic? Is there anything being developed based on the statistics that have been collected during this pandemic so far, or a plan?
Anybody from health want to take that?
I can speak a little bit to it. So in terms of like the statistics to inform a plan, I don't think we're entirely there yet. I do understand what you're getting at, but I think right now our main focus has just kind of been to get through this pandemic and this current wave that we're in right now. However, you know, we do have pandemic plans and different things that are already in place that have been worked on in previous council, previous administration, and things like that. Part of the push by government has been to, you know, let communities, give them the resources to start looking at updating them and making sure that they are reflecting kind of today's reality versus the one that was 20, 30 years ago when they were done. And so there is, you know, those kind of things out there that we are looking at. And as well, you know, I just gotta say, like, there was no way to kind of plan for this or to really look at protecting, because in advance, like really be prepared, because, you know, things change so rapidly with this. We were learning as we were going, just as everyone around the world was. It was so out of nowhere. So, you know, we did look at what our plans were in place and adapted them and move forward. But, you know, it was very hard with, and it still is to today with everything changing. I mean, we thought we had a handle on it, and then the variants come out, which just throw everything for a loop. So, you know, I understand what you're saying, and I believe that is our plan, but we kind of just want to get through this one right now. I don't know if any of my other fellow health portfolios will have anything else to add.
Adding on to Toby's, I think in the future, we're going to end up seeing this more as an immunization process, a booster of some sort after we do receive the vaccine. Probably like a, I don't know if I'm correct or not, tetanus, how you would do your tetanus every 5, I can't remember how it works, but similar to that. And this definitely opened the organization's eyes on what we had to be prepared for, or where the holes were. So we realized, like, you know, the predicament that some of us may have going through thinking of the quarantine program and how we had to get organized for the food security part of it, how we had to ensure that individuals that were told, okay, now you've been in contact, you stay home and you isolate. We had to ensure that needed to be prepared for, and how we had to go ahead and refocus stock in food. Other smaller details started coming out on unusual things. Just like the other day, I'm going to mention an individual was in quarantine, and her heater and her water heater went out. To find the resources, those resources to help her, because technically they shouldn't be in that home, and how they could assist, and how she could get provided some assistance, and how to work something like that out. I think with a lot of the programs and in the organization, they had to take a look at many different elements, how, how they can function at 50% or even 30%, and how to keep that rolling, how to allow other, in other areas, like in health. We had a cleaning company come in, and the Red Cross come in to help assist doing some cleanup at Yakisuta as a preventative measure. Those types of things. Learning how to do working agreements with those companies to, it's not to have money, but to have them come in,
Mm-hmm.
All those things need to come into detail. And it's eye-opening. Mm-hmm. And I think one of the biggest thing is to learn that communication is a big thing, and to how to get the community to listen to what you have to say. And when that communication gets dull and they're not, they're scrolling through, or it's becoming like, as I heard today, it becomes white noise. And how can we get them in a different, how can we get to them in a different way? We can't go knock on doors and let them know what's happening. How to deal with the mental and emotional part of the community, and also the organization, the staff. How we can combat that, how we can comfort on both ends, because both are tired. It's a big issue. And so there's some days where, you have to keep cheering each other on. And I know a lot of people I have to say, we do need the patience out there. But one of the biggest thing is the help from the community to say, I know it'll change their focus also, because when something goes wrong, when we have a death, and when we have a loss in the community, and your natural instinct is to gather, and yet we can't do that. And how we had to rearrange everything to go through video, even telephone, how to get that messaging through. I know it's not the same thing, but that's what had to be done. So it's quite the
challenging times.
Yeah, challenging times, and how we're going through this. And I think it's changing the organization in itself to where this is the new normal. Yeah. And it's going to be this way for some time. And I think the next step is to how to reconnect with community in a couple of years, and how that's going to change also. It's a whole mind-boggling thing, but that's what is going to happen and has happened. Yeah. Socialization is different.
Yeah. Thank you, April.
Also, so does that look like it's going to be like a phased approach then? Is that what you're going to try and do, is address it in different phases?
Well, right now, we already started with the schools, right? In the schools and in our meetings, we've already started the Zoom. We have that in place. I'm thinking that maybe sooner or later they're going to have to either make a decision if we continue on this way, more people working from home and to stay at home, or to go into the office. Now that we know that we're always worried about office space, and this may be the solution.
How do you hold yourselves accountable to the community if you're working from home? Because I don't think that's been happening with all 13 of you.
We have our telephones. We'll reach out to the community. We're always here to answer our phones. We're always in meetings. Right now, our phone lines, our extensions are connected right to our cell phones. So if they're calling from the administration office, it's going right to us.
I'm just curious, is there a cohort that's already been vaccinated in the organization or in the community? Is that already starting to happen, the vaccinations?
Not for the chiefs. I haven't received one. I don't know of anyone else.
Is there are any of the healthcare professionals, have they received it, or first responders or anything yet?
Yeah, some first responders have received it, some amps, some ambulance, the frontline workers in the healthcare in the long term in Yakisuta and Jungunusura.
That's great. Thank you.
So Brenda, can I go back to your question about how we would prepare our community for this to happen again? I think that we have a lot of challenges right now with this pandemic. And what we need to first of all do is learn from it and understand what we need to do better. And I think that key word is to prepare. I think we need to look at how our food becomes a sustainable thing for us that we can manage and do. So I know that we've had discussions on food sustainability. We may need to look at, we know housing is an issue, and this pandemic has certainly showed that with multiple generations in homes. We taught the healthcare field, you know, we know there's issues there, but it's not issues of staff producing what's needed, it's having enough staff. So I also think that with regards to emergency management, that we as a community and council and members all need to understand what that entails so that we're prepared next time. So it's really hard to say if we're going to have a plan or what we're going to do when we're still learning, going through this one and learning. So that's a big component in order to be prepared the next time. As far as accountability and transparency, I do provide monthly reports to the community. Thank you.
Well, those reports wouldn't cover a 40-hour week or a 60-hour week, certainly. They're just like attending meetings and kind of thing. But
I put more into it, what I'm working on. I also provide weekly reports to my council.
One of the things that I saw on the American side was the agricultural program that Wally Ransom has been hired to put together. And it would seem logical that MCA could put some financial support behind that to enable the northern portion to participate in that. It's already developed, it's functional, it's feeding the people, much more so than the little boxes that we got and the two plants of different types of plants to put in our little boxes outside. So it would be great if this council would start working with the tribe on some of these community-based things like that.
Yeah. Thank you, Brenda, for those questions, and my apologies. As I mentioned earlier, when Daryl got cut off, I was cut off as well and had to wait for the internet to come back on. While I am in an MCA facility too, so hopefully I don't have those issues, but it does happen. So,
well, when you mention internet, the fiber optic program that's happening, is that going to be community-wide?
There's one of the members. Yeah, I can just get one of the members to give a quick overview of that if you'd like.
All three districts?
Yeah, the plan is to go through all three districts with the fiber. We started in Snai because the backbone and the biggest chunk of it will get done getting to Snai. So that way, after we finish Snai and move to Ganadago and Gawanoga, that main cable is already there and it's just going along the roads and that. So that's why we started in Snai. We just had a meeting on Monday, I believe, and we spoke about where we're at. There is, I'm sure Edward can give more exact numbers as to how many kilometers and things like that. And so, yeah, Tisha says 8. We also have some active staff who are in here. But yeah, we've been looking at completing that within, I believe the goal is June to have Snai lit up. And then, you know, in the meantime, we are still pursuing the funding to get Ganadago and Gawanoga hooked up. We got a status report that they have it at like the head boss or whoever the higher ups are reviewing it. So we are hopeful that we'll get the final approval. We've had like contingent approvals on the funding for the rest of it, but we don't have that official final document. So that's what we're waiting on. I don't know if Chief Rompoint has anything else to add. I just went through it quickly.
He's not, can't hear him.
Can you hear me now?
Yes, we can.
Yeah.
Okay. Yeah, no, you touched on pretty much a lot of the main points. And I do believe currently they should be finalizing the crossing into Ganondago right now across the St. Regis River. So yeah, those are the main points that Chief Mitchell had addressed. And I think another update will be coming up in another couple of weeks as to where they're at in regards to the boring and then the when the fiber is going to start being pulled.
Okay, thank you. All right.
Will you also be looking at the opportunity to try and involve Mohawk networks on the Northern Territory so that we can have, you know, we're using local sourcing for our television and those kinds of things? Because that's a pretty good system.
They have reached out, and that was kind of our initial plan, but with the redesign and things like that, we've come to kind of realize that our connections aren't necessarily compatible. There's some issues around doing that. As well, we have like Canadian regulations and things like that we have to follow with this. So in order for Mohawk networks to do that, to, you know, let us, you know, for us to allow them to come in to do this, there's some things that they have to do on their end to become a registered business or whatever their process is for that industry, that they would have to go through to Canada. It is possible, but, you know, there are things that they have to do on their end, and we don't control that. We don't know what their plans are, but we have, and, you know, our acting director has informed them what she requires on her end from them. So now it's, you know, it's kind of up to them, but there's also the opportunity for individuals to form their own ISPs. You'll have to forgive me, I'm not very up with the technology, but from one of the updates that we had, one of the update meetings, you know, Rhonda and Kylie talked about that, about how individuals could potentially sign up and go through whatever they have to become a service provider. So we could potentially have people in the community doing that. There will be training and things like that coming out to assist them, but that's all being worked on as well. Again, Chief Rompoint may have things to add.
Yeah, again, she brought up a great point. It was in discussions that to put a call out or presentation to introduce community members that want to become entrepreneurs in establishing a license to become an internet service provider. So that is definitely ongoing as the development phase of the running the fiber to the home is underway. So there's a lot of working parts in how this is all being developed, and everything seems to be going quite well, minus a few hiccups here and there, but that's to be expected when you're doing a job as to this magnitude, I guess you could say.
Okay, thank you for those updates and those questions. I do see Cheryl has her hand up, so I'm going to go to you, Cheryl.
Thank you. I have a question, and I brought this up in the last meeting that I sat in on it, where the finance was presented. The East dollars, and I posed the question of what would it take for us to get our hands on that money? And what I want to do is put a challenge out to the 4 district chiefs of Gawinoge to sit down and take a look at what it's going to cost to finish the walking trail. Given the current state of this pandemic, and we all know that we're being asked to stay home, but we also know that we need exercise for our own mental wellness, and people like to walk outdoors. With the spring fast approaching, and then the summer will quickly get here just as fast, if you district chiefs could possibly look into the Easterbrook or possibly drawing some funds from there. I was going to do a petition on Cornwall Island, but I thought I'm just going to ask the 4 district chiefs to sit down, buckle down a little bit, figure out a plan to finish the walking trail at the arena. I know there's a plan out there somewhere. So I'm just putting that one out there. My second one is a question. When the updates were provided on the COVID, and I had listened to this one also about the residency issues about Canada, and the example was given if somebody's coming from Oka or Ganawage, and they show their status card that Canada's still going to require them to quarantine. My question to that is, has anybody received any complaints from CBSA asking for members from other territories that do reside here? Have they been asking them for any form of proof that they are residing here, even though they haven't transferred them?
We lost you at the last part. I think I got the gist of what you were asking. So since those rules were put in place last week about people who are traveling the border and required to have a valid COVID test, there have been situations that we have been dealing with. They're kind of on a one-to-one basis to ensure that people who may be residing here or working here but live or registered with other communities are able to cross over without having to provide a negative COVID. We have had a few calls in relation to the Dundee border crossing. We were dealing with an issue just recently with relation to that, specifically that a member of our community was being told they had to quarantine because their travel was not essential. We were able to work through that today. So if there are people that are having issues that are working for the Mohawk Council or are here for essential purposes, we can assist if they're having some issues. But if the people are coming from other territories to cross here and try to use a special exemption not have to quarantine or provide a negative test, they're not going to be exempt from that rule.
Okay, thank you. And something's been bothering me that's been brought up more than once to me, and it's a simple yes or no question, and it's basically putting a rumor to bed, I guess I would use that term. Is there any truth that Mohawk Council's internet is being paid for? It may sound stupid, but I have people coming up to me telling me this stuff, and I'm saying, well, then go ask Council. And our community, they don't want to ask this question, but it's irritating enough. It's the simple yes or no. Is Council's internet homes being paid for?
So this question was brought up on the CKON update that I gave yesterday as well, and it was or not. I didn't understand it at first what they asked, but essentially when the decision was, when we had to send people to work from home, as you know, as being a former member of council, we don't have the facilities here to have 13 separate offices, unfortunately. So our members of council at the previous location, and in fact, actually plan to be in one as well, all work in a common area. And under the current pandemic restrictions, that's not allowed. So in the transition to working from home, members of council were provided a stipend to assist with ensuring that they had the required equipment to be able to work from home.
Okay, thank you very much.
You're welcome. All right, so thank you. I'm going to open it up if there are any other members of the community that are joining us tonight that would like to ask a question in relation to the presentation or any other matter, to go ahead and raise your hand or unmute yourself. There was a question that was received ahead of time, which we do also accept questions ahead of time. We ask people if they have a question to ensure that it is answered to email it ahead of the meeting. One of the questions that we received was, when is the medical clinics going to be open again? In the surrounding areas, other clinics are open, so why is our clinic not open, but the staff can work when they have no doctor seeing patients? So if I could just get one of the health portfolio, I think Toby has said that she would address this question. If you could provide some information in relation to that question, please.
Yep. So we spoke to our acting director about this, and she stated that that's what the goal is. They're working towards it. However, with the pandemic and the vaccine rollout, Dr. Horn has become a little bit of an expert in this field. So she's been pulled in 100 different directions outside of MCA, as well as still trying to maintain the follow-up visits that are required with those. Like, there are some patients that are still receiving follow-up because of their care that they currently require, but not. So we are having a little issue with staffing, but we recently are bringing on a new doctor to work in the Quebec area. She is licensed in Quebec. She has to work at getting her Ontario license, which is, you know, a big switch for us. She will be starting soon. I don't want to give a date because we are bound by paperwork snafus here and there, but it will be coming very soon. She will be opening up the clinics, and I think that once the kind of vaccine rollout gets more underway, a lot of the committees and the request for Dr. Horn will slow down as well. I sit on the Ontario Chiefs Committee of Health and AFN National Chiefs Committee on Health, and so I get invites to a lot of different meetings. I see Dr. Horn at a lot. Anything with our Indigenous Physicians Association of Canada, she's there, and they have been, you know, spearheading the recommendations on the vaccine rollout for our countries across for our communities across the country. And as well, they've taken a big stance, a big project on tackling the anti-Indigenous racism in the healthcare system. So that all stemmed from that woman in Quebec, Joyce, I don't want to say her last name, I'll butcher it. But when she passed, and then a couple incidences in BC, so they've recently taken on this kind of issue and working with the ministers and people across the country. So right now, Dr. Horn is being stretched very, very thin, but we will have clinics open just as soon as we finalize the paperwork and get our new doctor in there. So it is coming very soon, but again, I don't want to give a date just in case. I don't know if anybody else on health has anything to add.
Hey, thank you, Toby, for addressing that question that was received ahead of time. I see that PJ has his hand up, so we'll go to you.
Hi, it's Paula. Can you hear me?
Yes, we can. Go ahead.
Hi, I have a question with regard to the FAL and whether or not there can be an established new timeline for that finance committee to be put in place. Whether it's going to be 6 months, 12 months, 18 months, but that FAL, when there was community presentation prior to it becoming law, community members were informed that the criteria and regulations were all being worked on at the same time. So I had expected that criteria would have been rules behind the FAL law, so you could call out for community members.
Okay.
And
Yeah,
the other
so-
thing I wanted to check.
Oh, sorry.
Grand Chief, you had made a comment on Tuesday about money being spent for COVID and that there was applications made hopefully for it being refunded. Oh, excuse me, whether or not there's approvals yet or money back. And lastly is, how much was your shipping you got?
Okay.
That's it.
Okay, thank you. I'll go to Edward on the first one, and then I can talk about the second ones.
Okay, and Yamo Paula for inquiring with that question. So I'm not sure if you were on the call during the presentation. So in my presentation, I had indicated in our timelines, there was various things that council was attending at the time, and basically that implementation process that you were asking about had kind of slipped a bit to the wayside. However, going forward, the criteria that you brought up, we are currently in discussion with council, as well as the finance committee in establishing what that is going to entail. And then we have established a short-term goal to at least get those mechanisms in place so we can begin the process of establishing that new finance committee under the FAL, so we can begin that transition. So I had also mentioned in there in my presentation that within the next couple of weeks, I'll provide another update as to where we achieved some of these goals so we can get the process moving. And then we can make that announcement for the call out for community members to participate in the selection process of this new finance committee.
Okay, thank you. And the second
can I
yes, you
just
can.
reply to is the short-term goal. We know it's an election year this year. I'm hoping it won't fall on again. So is that going to be within the months? We should have a community call out for reps to sit on the finance committee. Yeah.
Yeah, I don't see it going that far into the summer. I'm looking at, again, I'm still in my next finance committee meeting next week. We're going to have a discussion on setting that actual timeline. So, no, I don't anticipate it going that far. I'm talking more maybe 90 days or within that to see if we can achieve that. So I'll have a better definitive answer probably in my next update.
Okay, thank you for that. And the second part about that, I don't I'll recall specifically what I was, you've only given me a small snippet of what I said. If you could elaborate a little bit more. And then to your third question on the stipend, they were $1,200.
Yeah, the spending of money during the COVID-related expenses for special programs that were being done, like that food security program, other things that were done, and that money, your whole cover some of for those expenses, but you were monitoring closely what was being spent. So I just don't know, is it an application user doing? Are we going to get 100% back of what was spent? Because I know it was quite a bit in spending from what had been shown from previous meetings for COVID.
Yeah, okay. So I'm, most of the monies that we have received have been either through application for specific projects or have been through allocation, which it's not through an application, but it's an increase. They have most of it has been given for specific purposes, whether it be mental health, increase of costs related to PPE. There has been some increases for the schools. There's been enough increases, quite a few for infrastructure, like
All right, I think he froze again.
I did. I'm back.
Oh.
I don't know if this is going to hold. It's working again, but it's thinking. So that the monies that were received are
and he's gone. Nope. Are you there?
No, frozen.
Yeah.
And he's back.
okay. Try that third time, eh? Don't know if it's gonna stay. Okay. So stable. Oh, God. So as I was saying, a lot of the line items have been given for specific purposes. Now, one of the things that we know or we don't know is that how long the pandemic will last, if new injections of monies will be made into the organization for programming. But so that last month's presentation was pretty close. We haven't received too much more from what we provided last month, which we can share, and it is on our website. Gives a breakdown of the line items of where COVID monies have been provided to the organization. Now, I know lots of people, in the United States, we've seen direct injections into homes. None of this money has been designed or provided to be able to do that. And it's one of the big questions that we get from the community. But we will continue to provide updates on the financials that we receive and how it's being spent, going forward. I hope that's addressed your question.
Yes, thank you.
All right. I see, Cheryl, you have your hand back up. We'll go back to you.
Is there any other community members? I don't want to take up all the time asking questions, but I just wanted some type of a commitment from the district chiefs of Gawinoge to look into my issue that I raised about the Easterbrook money potentially being used to complete the walking trail over at the arena.
Cheryl, if I could answer that real quickly. I had brought this on the table with my portfolio economic development because they oversee the arena. So it was in discussion before we had broke for the holidays. And then after we came back from the holidays, they begun work right away on fiber to the home. So we actually, Chief Mitchell and I have portfolio meeting tomorrow with our acting director. So we'll bring it up again, and then we'll look at some timelines. So we'll keep you updated on that one.
Okay, thank you very much. I appreciate it.
Go ahead, Vince.
Yeah, also there was a reach out to us to get additional COVID monies through a program that we thought was a one-time funding initiative, but they were persistent, so we did a time-sensitive proposal. And in that, I was reached out to by Val Cree Cook, had to scramble around and the proposal together, and she worked with our DIH department on certain projects that's going on, excuse me, on Gawinoge, and the Gawinoge walking trail and the arenas and the walking trails elsewhere. We talked about putting that in there as an initiative to get funding for it, because it is a recreational area and it is used by our community members. And at this time, whatever exercise we can get, and let's enhance those trails so that way people will utilize them and be not twisted ankles and whatnot through the ruts that are done by four-wheelers on those trails. So it's in the works. We're just waiting for a response if our proposal got accepted or not. And once we do get that money, if it was stipulated to be used in that fashion, I guess that's the next steps that will be taken.
Thank you very much for that. Okay. If there are no other questions, I am going to move forward with our regular business of accepting a resolution for the last, accepting the minutes from the last general meeting of January 28th. So to accept and approve the attached general meeting minutes dated January 28, 2021. If I could have a mover, please.
I'll move.
Moved by Tim, second by Connie. Discussion on the resolution.
Question
has been called on the resolution. All those in favor, please hold your hand in front of your camera. Any against? There is none against. Thank you very much. The resolution is carried. Okay, so that is going to conclude this evening's general meeting for February 25th. I do want to thank everybody for joining us this evening. Our next general meeting will be held on March 25th of next month. We ask that you email meetings@akwesasne.ca ahead of time for the link. And if you have any questions that you'd like us to address at that meeting, please do so through that, but we will also take them provided we have time on the meeting itself. So on behalf of myself, I want to thank all of you for joining us this evening. We ask that you please continue to exercise patience and remain safe as we continue to deal with this global pandemic that we're dealing with in our community. And thank you to all of you for doing your part in keeping yourself and our community safe. So Yamagoa. With that, could I have a motion to adjourn this evening's meeting, please? Moved by Vanessa, second by Edward. Yamagoa, thank you very much, all of you. Have a great evening.